A new arthritis vaccine is showing promise in clinical trials. It could replace the need for patients to take a daily dose of painkillers.
Joining us now is Dr. Devi Nampiaparampil. She is a Fox 5 contributor from the NYU School of Medicine. You were saying this is promising news.
Yeah, I'm very excited about it for a few different reasons. I mean, we're talking about this specific trial, but this class of medication is called NGF inhibitors. So NGF stands for nerve growth factor. Now, generally, if you think about any kind of painful condition, whether it's arthritis or otherwise, generally our treatments, in terms of medications at least, are anti-inflammatory medications, right, or opioid medications. We have the opioid epidemic. Neither one of these is perfect. You know, they can help with pain, but obviously a lot of issues. So with the anti-inflammatories, you know, kidney issues, gut issues, heartburn, and then with the opioids, addiction, but also a lot of other side effects. Not everybody can tolerate them. So this new class of medication works differently. That the idea is that when they've studied chronically painful conditions like arthritis, there's something called NGF or nerve growth factor that goes up. The levels go up. Now that could be because it's involved in healing, or it could be because it's trying to sensitize your nerves so you feel more pain, right? Your nerves are becoming more sensitive. So if we can block that, then people may not feel as much pain, and it won't have all of those side effects that the other classes of medications have. So very promising for that reason, because it wouldn't be addictive. Now, they have done some trials on this in the past, and it seems that one of the issues is that people did have pain relief, but sometimes their arthritis got a little bit worse in the interim. So it'll be sort of a question of balancing those things out and looking at it a little more. The other reason I'm very excited about it is because if you look at all the medications and things that we've had for pain in the past, it's usually a rehashing of something that was already there in the past. So for example, with anti-inflammatories, they're all in the same class, but there are different ones that come out, you know, maybe year to year, or this one's longer acting, this one's shorter acting, this one's this dose, this one's a higher dose.
All a variation of each other.
Exactly.
But this is totally
different. We don't have something like that right now, and maybe it could really change the whole face of pain management.
Which is encouraging and much needed, for sure.
Exactly.
All right, let's talk about this. I'm kind of excited about this. A new study finds that it takes more mental effort to try to forget something than to remember it. I feel the total opposite.
Right. I feel like I forget things all the time,
and I have a hard time remembering something, you know?
Well, I feel the same way. I mean, I looked at the study a little more closely. So they were talking about not just when something is happening and whether you remember it or forget it, but if somebody actually tells you to forget something. So if they tell you something and then tell you to also forget it, sometimes just that act can make you remember it a little bit more, right? So they were studying whether we can control whether we forget things. And it seems that we have some control over it. So let's say somebody tells you to forget something. If you try too hard, then it's just going to stick in your memory. You're not going to forget it, right? So there's a delicate balance to it. And the reason that this matters is there are things that you might want to forget, right? Usually we're talking about things we forget that we didn't really want to, but traumatic events.
Of course.
We were just talking about pain, you know, for the other story, but
childbirth.
Well, that's a good example.
The amnesia the first couple months does that for you, I think.
But yeah, there are things that you might want to forget, and especially things that are chronically painful or very traumatic. If we could figure out what parts of the brain are involved in helping you forget, then imagine how that would change things. And then we're talking about medications, but these are strategies maybe that could be used by psychologists, psychiatrists, by different people just to help you non-pharmacologically heal from different wounds.
Okay.
Very interesting.
Right. Yeah, it really is. Thank you, Dr. Nampiaparampil. We appreciate it.